These efforts are just a fraction of the work put in by my team at the Health Emergency Operations Center and the support from Wendy Smith-Reeve and the team at the State Emergency Operations Center to build capacity in our healthcare system. As a public health professional, I want to take a moment to address the very real mental health impacts our citizens face in light of these recent events. Whether it's nutritional impacts for our children who are out of school, the fear in our high-risk populations, and the anxiety of those who just miss hugging their parents and grandparents. It's important that we not mistake the responsible practice of social distancing to mean encouragement of emotional distancing and isolation. Remember, everyone deals with stress and anxiety differently. During these difficult times, everyone could use a little extra compassion and kindness. And finally, I know some of you chuckle as I repeat these lines, but they really are so important to ensure we reduce the spread in Arizona. Wash your hands often with soap and water or used an alcohol-based hand sanitizer. Avoid touching your eyes, nose, and mouth with unwashed hands. Avoid close contact with people who are sick. And if you are sick, please stay home. Cover your cough or sneeze with a tissue and immediately throw that tissue in the trash. Clean and disinfect frequently touched objects and surfaces. And if you need to see a healthcare provider, consider using telemedicine. Stay home whenever possible and avoid crowds of 10 or more people. It is best to keep 6 feet between you and others when you are in public. Avoid social visits, shopping trips, and discretionary travel. Do not visit nursing homes or long-term care facilities unless you are providing critical assistance. And practice social distancing everywhere. With that, I'll hand it back to Governor Ducey.
Thank you, Dr. Chris, for the work you and your team have done to preserve public health and prepare for what's to come. I also want to say a big thank you and shout out to Wendy Smith-Reeve with the Division of Emergency Management and General Mick McGuire with the Arizona National Guard. I'm grateful for their commitment and leadership and the work of your dedicated teams working together to combat COVID-19. Many of you have asked if or when the state will move towards a stay-at-home policy. The answer is not at this time. We're following the facts related specifically to the state of Arizona. The CDC isn't there yet. Arizona is not there yet. We're not at the same stage as other states. And today, on a call with the state's governors from around the country, the Vice President made it clear there have been no discussions about a nationwide lockdown by the President's Coronavirus Task Force. As I travel around the state, it's obvious that citizens around the state are already staying at home and acting responsibly. There's empty streets and empty sidewalks and traffic-free highways. But we all know the risks. The virus is most harmful to those we love the most, our grandparents and our parents. All of us should heed the advice of public health officials. These are unprecedented times, and our approach has been to proceed with a calm and steady manner and with a sense of urgency, and to provide certainty wherever possible. To that end, today I'm issuing another executive order for the employers, families, and citizens across the state that details what are essential services. Again, we are not implementing a so-called shelter-in-place policy as other states have done. This is a proactive and administrative measure that ensures that the state has one consistent, overarching policy that is based on CDC and public health guidance so that the people of Arizona across all jurisdictions, cities and counties have clarity and consistency. It's my hope that we stop the spread, protect our economy, and mitigate the need for further action. But this order will allow workers and employers to responsibly plan for what things look like in the weeks ahead. We've had to make some tough decisions designed to protect public health, decisions that have been tough for our workforce, small business owners, and families. I want to thank all Arizonans for their cooperation during this time. We know this is creating economic challenges, and they are ones that we will be addressing in the days, weeks, and months ahead. Our commitment to Arizona is twofold: protecting public health and our economy. We're all in on both. And with that, I'll open it up to questions.
Howie, let's start off with where you left off about the economic challenges. The legislature did approve the contingency budget, $50 million for you to use at your discretion. But the fact is, even with what utilities are doing, people are in danger of being put out of their apartments, out of their homes, having their cars repossessed. What are you going to do about all of that?
So our focus has been first and foremost on the urgency of this issue on COVID-19 with the framework of let's do everything possible to stop the spread, to avoid Arizonans contracting this disease. Secondly, for those that have it, those that are infected, we want them to have the proper care, we want them to have the proper comfort. We want us to have the proper hospital capacity that's necessary. Third, we're focused on those that are on the front lines, the doctors, the nurses, the emergency medical responders, the first responders, that they have the protection. That's the gloves, the gowns, the masks, the PPE. And we care about the people that are being affected, that are living paycheck to paycheck. I mean, that is an overwhelming concern of what we're doing. I applaud our legislature operating in a bipartisan fashion to get dollars to the governor's office. We're also working on an economic protection plan. It's 14 pages long right now. We worked on it all weekend, and that's going to be for a press conference in the very near future. Like I said, the priority and focus, first and foremost, has been public health, but we also realize what's going on in the economy, and we know we need to address that.
Let me just quick follow up to that.